Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Minoxidil, and we'll discuss it as the systemic oral version. You may have heard of this medication in the topical version, but today it'll just be the systemic. The brand name for this medication is Loniten. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Minoxidil. We'll then discuss examples of dosing, and then follow it up with side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So the exact mechanism of action for lowering blood pressure is not completely understood. However, we do know that it causes direct vasodilation of arterioles with little effect on veins. It reduces peripheral resistance and causes a reflex increase in heart rate and cardiac output. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of refractory hypertension or high blood pressure. With respect to contraindications or reasons we would not be able to prescribe Minoxidil, we wouldn't give this medication to a patient who had a hypersensitivity to Minoxidil or any other component of the formulation. As well, we wouldn't give this medication to a patient who had pheochromocytoma, which would be a rare tumor of the adrenal gland tissue. Now for an example of dosing with Minoxidil. So in the treatment of hypertension or high blood pressure, the initial dose would be 5 milligrams orally once daily. They would then increase the dose to 10, 20, and then 40 milligrams in single or divided doses in 3-day increments. The maintenance dose would be 10 to 40 milligrams per day, again in single or 2 divided doses, and the maximum dose would be 100 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Minoxidil. We'll go over some of those here now. Some patients may experience hypotension or low blood pressure. Other patients may experience hirsutism, which would be when a female would grow male pattern hair, usually on the face area. Hypertrichosis would be an issue for some patients, which is excessive hair growth, different than hirsutism. Body fluid retention is sometimes a side effect for some individuals, as well as hypernatremia or high sodium levels. Now, 2 serious side effects would be angina pectoris, or chest pain, as well as an abnormal electrocardiogram. Alright everybody, that's all we're going to talk about today with Minoxidil or Loniten. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.